All right, so welcome to Bioscience Lecture 19. This is our last session in this course and the topic today will be the endocrine system. We have about 40 plus slides, but those actually is a lot of explanation, a lot to explain. And yeah, so let me just clear up some things here. I should clear up this before. Okay, so my God, this is my writing. Okay, there you are. Okay. All right, so here we are. Lecture 19, endocrine system. All right, so just when we talk about endocrine system, you remember previous classes where we were talking about the epithelial tissue, right? Remember the epithelial tissue? Epithelial tissue, right? We have the epithelial tissue, and the epithelial tissue are going to be with different stratified or actually no stratified tissue. But in general, we have basically the skin and all surface that cover the organs outside and inside are going to be epithelial tissue. Epithelial tissue is going to comprise to the glandular tissue, the glands. These glands are actually secreting a substance. These glands is part of the epithelial tissue. So all the glands are part of epithelial tissue. Now, the glands we are going to classify in two main components, and that's where we are going to start. Okay, so we have glandular tissue or glands are going to divide it into exocrine and the endocrine glands. Our topic today, as you can tell, are the endocrine glands. The endocrine glands. All right, so talking about the exocrine glands, just to make it brief, we have basically all these glands, they have ducts. They have ducts or duct. And endocrine are ductless. There is no ducts on. Example of exocrine, we have for example, the sweat gland. Sweat gland. They're going to secrete sweat, right? That is the sweat glands. Other glands, why is exocrine? They are exocrine because they have this duct. The endocrine is different. The endocrine we have, for example, the thyroid gland, and the thyroid gland is going to be innervated by a lot of vessels. The thyroid gland is going to produce that hormone, and they are going to go directly to the blood flow, so to the blood circulation. So there is no ducts in between. So we have the thyroid gland, we have the pineal gland, we have the pituitary gland, we have the adrenal gland. So there is different type of gland that we are going to talk today. One make some remark is about this guy, is the pancreas. Pancreas is a gland that is going to have two components. the exocrine function because they have a duct that is leading into the secretion of the pancreatic juice. Pancreatic juice. Pancreatic juice. And we have another area that are going to be composed by islets that we will see today, the islets or Langerhans that are going to be not connected with this duct, but are going to go directly release the substance into the bloodstream. Those are called the islets of Langerhans. And what are doing this? Producing the insulin. Insulin. So the pancreas is a mixed gland, in conclusion. So now you can tell the difference between endocrine and the exocrine. You okay with that? Okay. Okay, so let's talk about the endocrine system. Works in synergy with the nervous system. All right, so this is very important, guys. Why? Because the endocrine system is going to work together with the central nervous system. In the central nervous system, you better start getting familiar with is the diencephalon. Diencephalon that contains the hypothalamus. Diencephalon that contains the hypothalamus. Previous class, you learned about the hypothalamus. Hypothalamus is the center of the temperature, the thermostat, right? But the hypothalamus is much more than that. The hypothalamus is part of the central nervous system. But why we are talking about hypothalamus, central nervous system, if we are talking about endocrine? Why? Because endocrine and the nervous system working together. Who is actually the commander of that is the hypothalamus. Okay? Okay, so, and the hormones are going to be basically under the orders of the hypothalamus and the pituitary gland, as we are going to see in the next few moments. All right, so we have adipose tissue, for example, hormones that are not, you're probably not familiar with yet, is the leptin. Leptin, we already talked about that in the past, and the leptin is going to be an hormone secreted by the fat cells, fat cells. These fat cells produce the leptin. When the fat cells are going to produce the leptin, when you actually, after your meal, you eat, basically the nutrients are start to get into the cells. And the adipocytes means the lipid cells are going to start accumulating some surplus if that is happening. And basically all this distribution of nutrients are going to make the adipose tissue to secrete the leptin. The leptin go to the brain and telling the brain, you know what, I'm satisfied. I don't want to eat anymore until next meal. Okay? Leptin. So that is an hormone. So what is the purpose of that? I'm going to ask you what is the leptin? No, that is actually from previous class. What I want you to recognize what is important. The important is that this adipose tissue is an endocrine. It works as an endocrine gland, and they do not have any ducts. So these are going to be one of the many examples. We have another example is the kidneys and the erythropoietin. The erythropoietin. The erythropoietin, if you remember, please help me with that. We have the red bone marrow. What happened in the red bone marrow? What is the function of the red bone marrow?
The production of white blood cell
What is the process called? How is the process called? Hematopoiesis. So everybody say hematopoiesis, please.
hematopoiesis.
Hematopoiesis. Everybody, I say here only one. Everybody, please. If you don't
Hematopoiesis.
where is happening hematopoiesis?
In the Red bone marrow.
Where everybody, where is happening the hematopoiesis? Where is happening?
Red bone marrow.
The red bone marrow.
Everybody, red bone marrow, excellent. And the erythropoiesis happening in the red bone marrow, they have three lines, right? One is the erythropoiesis, yes or no?
Yes.
Yes. We have production of white cells and platelets, correct? Tell me,
Yes.
erythropoiesis is the same to say hematopoiesis, yes or no?
Yeah.
Yes.
Yes.
No.
No.
No?
No.
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 Oh my God. Okay, let me. All right. How many? Hematopoiesis is not the same to say erythropoiesis. Hemato, what does it mean, hemato? Hemato means blood. So it's more general. More general. When you talk about hemato blood, you're talking about red blood cells, white cells, and platelets. But you're talking about erythropoiesis, and erythropoiesis is just the red blood cells, no the white cells, no the platelets, are the red blood cells. Erythro means red. You okay with that?
Yes.
Okay, so I will tell you why I'm so, not picky. I mean, it's something. Why? Because in the future, you're going to learn the medication that is going to give for chemotherapy when you suppress the red bone marrow. And it's not the same to say hematopoiesis than erythropoiesis. So that you're going to have around that type of questions. So if you don't know what is the difference between hemato and erythropoiesis, your brain is going to be like a knot. It's totally tangled. So you need to remember that, okay? All right, so the hematopoiesis is going to have three components, erythropoiesis, and the erythropoiesis is the production of red blood cells. 2 million red blood cells per second. And the stimulus for the red bone marrow to produce red blood cells is the erythropoietin. Can you see the similarity of the word? Erythropoiesis versus erythropoietin. Erythropoiesis is the formation of red blood cells, red, no hemato, erythro, and production of red blood cells, and that is stimulated by an hormone called the erythropoietin. Erythropoiesis versus erythropoietin. Erythropoiesis versus erythropoietin. You okay with that?
Yes.
Yes.
Okay, we have the small intestine, we have the secretin that is going to stimulate secretions on the intestinal lumen, especially the ileum, and the CCK is the cholecystokinin. It's another hormone. Now, what is doing the cholecystokinin? The one, if you eat more, the gallbladder contract more. If you eat more gastric acid will going to produce. And who is stimulating that? The secretin. The CCK, the cholecystokinin. So, what is the concept here? What I'm trying to show you in this slide? What I'm trying to show you in this slide that there is the endocrine system can be in many parts of the body, not only the classical thyroid gland or the classical ovaries, testicles. No, are going to be much more than that. Okay, we have adipose, kidneys. Those are examples. Probably going to ask you about the erythropoietin and the erythropoiesis. Okay, so you must know that, everybody. Oh God. So machine looks like he wants to finish fast. Okay, so here is the division. Exocrine glands, fluid secretion, mucus, milk, sweat, saliva. One more thing. Breast. Breast is an endocrine or exocrine?
And exocrine.
Exocrine, because we have the lacteal ducts, right? So mammary gland have ducts that are going to produce or secrete the milk. That is exocrine. So endocrine will be the ductless glands, like the adrenal gland, like a thyroid gland, like a thymus. We are going to see that. So that is the big classification. The topic today will be, we will be talking about the endocrine system. All right. So what is an hormone? So if we are talking about endocrine system, and we will see the connection with the nervous system, right? So that is called what we call homeostasis, correct? Homeostasis, yes or no? Right?
Yes.
Okay. Now we need to know what is an hormone. You need to differentiate. Please, students get confused. What is an enzyme? What is a vitamin? What is an hormone? Hormones are completely different situation. Hormones are going to have basically composed by proteins. Proteins. The majority of the hormones are going to be formed by with proteins. Some of them are going to be formed from cholesterol, from fat. But the majority of hormones are going to be proteins. We okay with that? Yeah.
Yes.
Okay, perfect. So those are hormones. And hormones are have some activity. This activity, hormones are. If you hear the word hormones, you need to say yourself, "Oh, hormone means a message." Hormone is going to give a message in order to. It's an order that is going to send it to the body, and the body will be actually follow that. For example, we have hormones, the T3 and T4. What is doing the T3 and T4? What they are doing the T3 and T4? What do you think? So you know the thyroid gland produce T3 and T4, right? No? Hello?
Yes.
So what is the T3, T4 doing? What is doing the T3 and T4 in your body? Okay, I will tell you. T3 and T4, and never forget that. You promise you will never forget? No? Please promise, because in order to say what I'm going to say, they put you 2 chapters, 3 pages, 4 pages to say the same thing. What is doing T3 and T4? T3 and T4 enter into your cell and make them produce more ATPs. Period. That's it. T3 and T4. Okay? All right. So what I'm trying to tell you here is that the hormones, they have a specific target. They have a specific target. For example, we have the LH. This is an hormone, the lutein hormone, that is producing the ovulation. Okay, so that is what is the target organ of that LH. The target organ of that LH will be the ovary, and the ovary is going to produce the ovulation. The LH is not going to go to your nose, and you're not going to ovulate by your nose, because the target organ is not your nose. The target organ is the ovary. So that's why it's going to have a target organ. And all hormones, they have a specific targets. We okay with that?
Yes.
Okay. Now, the first step, what you need to know, and that is what we are going to memorize. You're not going to go out without memorizing these hormones today. Hormones are going to be messengers, and you need to know the name of the whole hormones that we are going to talk today. Second, you need to know what is the target organ, and third, what is the function of this hormone. Okay, so name of the hormone, target organ, and the function of the hormone. For example, I will tell you the growth hormone. The growth hormone is the name of the hormone. Growth hormone. What is the target organ of the growth hormone? The target organ of the growth hormone will be muscles and bones. So what is the function of the growth hormone in muscles and bones? It's going to be, you can tell me, growth. Okay?
Yes.
So for that, you're going to learn about 9 to 11 hormones, new hormones today. All right. All right. So for this slide, what I want you to remember is this. The majority of hormones, they have a specific target, etc., are going to be made from proteins. The majority of hormones are going to be proteins. Some of these, not the majority, some a few percentage are going, but not the less important, are going to be formed from fat. For example, that fat is going to be the cholesterol. So we have hormones that are being made from fat, and the big majority are going to be formed by proteins. Okay? Who right now oxytocin with it's all right, so for this, we are going to talk about the anatomy of the of homeostasis. The anatomy of the homeostasis is very simple, but very important at the same time. So we have the diencephalon. What is inside the diencephalon? So somebody can tell me. What is the diencephalon? Diencephalon. What is diencephalon?
It coordinates with the
Small.
endocrine system,
Where is the
the
diencephalon?
helper.
The brain.
Small part
The
of
small
the brain.
brain.
Small brain? No. Okay, remember we was talking about the brain and the divisions. Remember the skin of the orange, like an orange, and the seeds. Remember that? Remember that? No. The skin is going to be the cortex or the gray matter of the brain. The pulp of the fruit is going to be the white matter. And the seeds of the orange will be the diencephalon. Are the diencephalon. And inside the diencephalon, we have one of many nucleus. One of those is the hypothalamus. So where is located the hypothalamus? You will tell me the diencephalon. Okay, the diencephalon. Okay, the seeds of the orange. You remember now or no?
Yes.
Okay, so that is, write down this, number one, the diencephalon contains the hypothalamus. Number two, I want you to write down, the hypothalamus is composed by gray matter. Parentheses are the sinkers. Okay, the diencephalon, they are going to be composed by gray matter. Okay, and we have epithalamus, we have thalamus, we have hypothalamus, we have caudata, we have what is that? I forgot the name. What is the name? Different nucleus. Anyhow, we have different nucleus. What is the name? Oh my God, I get upset with that. Okay, so the diencephalon is made by gray matter. So there are sinkers. They are making decisions. So don't just say, "Oh, gray matter." Okay, so what? Gray matter. Gray matter is going to make decisions because they are gray matter, similar as the cortex of the brain. So that's what you need to remember. So, and we have the hypothalamus there, hypothalamus. So where is the hypothalamus? The hypothalamus, if you go here to the more prominent area of your forehead here, okay, and go horizontally all the way back to the middle here, and make a curl, do on the top of your brain, of the head, put a finger there and make a cross street. That is in the cross of those lines is going to be the hypothalamus. It's going to be the hypothalamus. Hypothalamus is gray matter. Hypothalamus is a thinker. So hypothalamus, you can write down like a number 3 is that is called, there's no in any book like this, but you will know why I'm calling it like that, is the big gossiper, is the greatest gossiper. Do you know somebody who is gossiper? Not here, of course. There is nobody gossiper here. Tashi, you are smiling. Why are you smiling? You know somebody, right? Very gossip, right? Gossiper? Okay, all right. Yeah.
Dr. GD, can you repeat number 2?
Number 2 is produced by is made by gray matter. But tell me, because I said so many things. What is the key for number 2?
So the first one you said diencephalon contains gray matter. That was
Yeah.
number 1, and then you said number 2. I missed it.
Number 2 is number 2 is the diencephalon is composed by many components. One of these is the hypothalamus. The hypothalamus. Okay? The hypothalamus. So hypothalamus, Lisbeth, is gray matter, yes or no?
Yes.
Yes, right? So it's a commander, yes or no?
Yes.
Yeah. And now, number 3 is what I said is the big gossiper. I call the big gossiper. Why I call the big gossiper? Because, Tashi, you know what? They know everything. Everything they know. Yes. So a big gossiper we can call hypothalamus because everything is known by the hypothalamus. If you are cold, who knows that? The hypothalamus. If you are hot, who knows that? Hypothalamus. If you are hungry, who knows that? Hypothalamus. If you are sleepy, who knows that? The hypothalamus. If you are dehydrated, who knows that? The hypothalamus. If you are dehydrated, what else? If you are I would say hungry or you are satisfied, who knows that? Is the hypothalamus. If your pH of your blood is changing, who knows that? The hypothalamus. Now tell me, who knows this? A kid of 8, 10, 11 years old is growing. Who knows that the kid needs to grow?
Hypothalamus.
Don't tell me the parents. Yeah, the hypothalamus. Okay, the hypothalamus. So then we have, if the mother is lactating, who knows that the mother needs to lactate to produce milk?
Hypothalamus.
Who knows that? The hypothalamus. You are doing exercises in the gym. You require more ATPs and you need to produce more T3 and T4. Who knows that you're doing more exercises and your need of ATP are higher? Who knows that?
Hypothalamus.
Hypothalamus. Okay? So, when you are stressed, you release a lot of cortisol. Who knows that you are stressed? Just for practice, just tell me.
The hypothalamus. And myself.
Hypothalamus. You're going to ovulate. You're going to ovulate. Who knows that you're going to ovulate? Hypothalamus. See? So you're going to produce, in your menstrual cycle, you produce estrogens. Who knows that you are low in estrogens or high in estrogens? Who knows that? Again, please.
Hypothalamus.
Hypothalamus. Now, you are pregnant and you are going to deliver a baby. Who knows that you need to deliver a baby in that moment? Who knows that you're going to enter into labor?
The hypothalamus.
Hypothalamus. Hypothalamus know everything, yes or no? And that is the big gossiper. So the big gossiper. So, and tell me, hypothalamus is endocrine or nervous tissue? My question is why you doubt? The hypothalamus endocrine or nervous tissue?
Endocrine?
Nervous tissue.
If I said hypothalamus is part of what? Hypothalamus is part of whom?
The brain.
The diencephalon, right? And the diencephalon is part of the brain. So diencephalon is nervous tissue. So the diencephalon is nervous tissue. So diencephalon is the nervous tissue. So, as a conclusion, diencephalon is nervous tissue.
So hypothalamus is nervous tissue.
Exactly. Very good. So I'm saying that because in the past many students make that confusion. Okay, they're a bit confused on that. All right, so we okay with that, right? Okay, so the big gossiper is going to know everything that happened in our lives. But knowing that and to be aware of the situation, you're going to, the body needs to do something to keep the homeostasis. For example, now we are going to the nervous tissue, that is the hypothalamus, the encephalohypothalamus, nervous tissue, the nervous tissue hypothalamus, the encephalohypothalamus, nervous tissue. This guy is going to be connected with the endocrine system. Who is the endocrine gland that is going to be participating in this connection? That is what we call the pituitary gland. The pituitary gland. The pituitary gland. Pituitary gland. Pituitary gland. Tell me, pituitary gland is nervous tissue or nervous tissue or endocrine tissue?
Endocrine.
You said endocrine or endocrine?
Endocrine.
Excellent. See? But listen to the name. So I don't know, most of you probably did it, but if you didn't, you need to practice. So you are skipping words. You are not thinking about the words. You need to think about the words. I said pituitary gland. Gland. I said gland. So gland, what is this? Gland is nervous tissue or glandular tissue? It's going to be glandular tissue. Gland, pituitary gland. And this pituitary gland is going to be called the master gland. Master gland. Pituitary gland or master. There's other name. The hypotheses are going to show you later. So master gland. Master gland. Why? Because the master gland is the one who really is mastering to produce the hormones. So it's basically the pituitary gland who secrete the hormones from the pituitary gland based on the orders of the hypothalamus. So the hypothalamus is going to know. Hypothalamus is saying, I need this, I don't need that. So, and who is going to be his subordinate or under his level, his supervision, etc., is going to be the pituitary gland. The pituitary gland. The pituitary gland is the one who secretes all these hormones, the growth hormone, prolactin, the TSH, the ACTH, the luteal hormone, follicular hormone, oxytocin, and antidiuretic hormone. Melatonin too, we are going to see that, and other hormones that we will talk. So all basically are going to be in complete cooperation, coordination, synchronous, working between the nervous tissue, the hypothalamus, and the endocrine system, the pituitary gland. So the pituitary gland is receive the orders of the hypothalamus. The hypothalamus is telling you, oh, this kid is 12 years old, they need to grow. Okay, I know already, so what I should do? The hypothalamus is going to tell, okay, pituitary gland, you, pituitary gland, we need to grow. Okay, so, and the pituitary gland, what it's going to do is to secrete the growth hormone. See how is that connecting? The nervous tissue with the with the what? With the endocrine system. Okay. All right. So let's keep moving. Where's my PowerPoint? Okay, so for this, you will see that just to give you an idea where is the pituitary gland. So here in the forehead, where is the more bulging area, go to the center. That is the level where it's going to be the hypothalamus. But now look at this. If you trace your line from the arch of your eyes, the eye socket, all these the superior one, go all the way down, all the way behind to the middle, and then cross a midpoint. So you will see that that is the level of the pituitary gland. If you can tell, the arch of your eye is this, and this is the bulging of your head. So this is the distance approximately that are going to be between the pituitary gland and the hypothalamus. And that's what I'm going to show you now. So here we have the hypothalamus. This is the hypothalamus. Where is my pen? Here. It's going to be all these areas, the hypothalamus, and this here is called the pituitary gland. So that is the connection. And the hypothalamus is going to know everything because and they're going to say, oh, I need this, I need that, I need this, I need this. And the prostaglandin, mastering all the arts, are going to secrete what the hypothalamus is telling to secrete to the pituitary gland. You okay with that? Okay.
Yes.
Excellent. So here we have the diencephalon. Diencephalon, please, the seeds of the orange. The seeds of the orange, that is the diencephalon. Inside the diencephalon is the whole area that is composed, part of that, by the hypothalamus. So here we have, this is the hypothalamus, and this area is going to be the pituitary gland. How close they are, right? So here we have, this is the diencephalon, and the pituitary gland is not showing here because it's too medial. It should be a little bit more anterior. And they're going to be approximately here is going to be the pituitary gland. Can you see that strategically located close to each other? Okay, so let's keep moving. All right, so we have 9 major endocrine glands. We have the pituitary gland. You start to get familiar with that. We are going to add another name very close, very soon, the hypophysis. But you remember, pituitary gland, master gland, it's the same thing. Thyroid gland produces T3 and T4. The adrenal cortex. Adrenal cortex is related to the adrenal glands, the adrenal gland. Adrenal glands are 2 glands located on the top of the kidneys. So this adrenal gland do not belong to the kidney. It's an addition. It's on the top of the kidney. So we are going to see that in a few moments. And gonads. What are gonads? This is medical terminology. I'm going to go from simple to more elaborate. Gonads, what means gonads?
Sexual organs.
Reproductive organs. Excellent. The reproductive organs. Okay? So the gonads. Gonads will be the testicles. Gonads will be the what? The ovaries. Okay? Gonads. Okay. Pineal gland. The pineal gland. Pineal gland is what they call, basically, colloquially, they call the third eye. The third eye. So every time I do this and ask you a question, that is the third eye. Third eye. This third eye is the pineal gland. It's in the PowerPoint. It's the pineal gland. The pineal gland. And this pineal gland is going to secrete an hormone called the melatonin. Do you want me to spell that? I don't think so. Or you want it? Melatonin. 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 Don't get confused with the melanin. What is the melanin?
The pigment of the skin.
Excellent. The pigment of the skin. That is melanin. Nothing to do with the melatonin. Okay? Who secrete the melatonin?
Pineal gland.
The pineal gland.
The pineal gland. And what time the melatonin is going to be secreted?
Nighttime.
At night time. At night time. Melatonin is going to be secreted at night time. So that's why you know how they call the melatonin? They call the Dracula hormone. Dracula hormone. Tell me, at what time appeared Dracula?
Nighttime.
There you are, right? See? At nighttime. Okay, Dracula appears at nighttime. So that's why it's called the Dracula hormone, the melatonin. Melatonin, you're not going to take melatonin in the morning, in other words. Right? You're going to take melatonin at night. All right? So to keep your help you to sleep. You okay with that? All right. All right, so we have the parathyroid gland, and the parathyroid gland is the thyroid gland or no? Parathyroid. What does it mean, parathyroid gland? Parathyroid gland is called parathyroid gland because, first of all, this parathyroid gland is totally different gland from the thyroid gland. Thyroid and parathyroid are going to be completely different stuff. Completely. Okay? But these parathyroid are located it's going to get behind the thyroid gland. It's like you have, for example, you are walking and some friend is getting close to you. So that is actually close, but you're not your friend. You're totally different, right? Okay. So now, why is called parathyroid? Somebody can tell me. Jasmine, you're looking in the ceiling. There, you found the answer in the ceiling. I see. No, yes, no. Okay. All right. So parathyroid is called because the parathyroid gland are parallel to the thyroid gland. Make sense now or no? Right? Parathyroid because it's parallel to the thyroid gland. Okay. So this parathyroid gland is going to be part of the homeostasis of calcium, and we are going to see in the next few hours. All right, so let's keep moving. Thymus. Okay, tell me, what is thymus? What do you can tell me about thymus? Thymus. Tell me, what is the thymus? Where is the thymus? Where
In
is
the
thymus?
chest.
What part of the chest?
The chest.
Between
Breast.
the lungs.
Behind the
All
sternum. You know what is the sternum? The sternum, right? That is the chest bone.
the lungs.
What lungs? No, it's behind the sternum. Just exactly behind the sternum. That is the thymus. What is the function of the thymus?
They produce T cells.
T cells. So they're going to make mature the T cells. Right, Deborah? Right? Okay. So that is the T cells. And you know, they make a tour, they try to memory of all what belong to your body, right? Do you know that? We explained that or no? Tell me.
I don't
Yes or no?
recall.
No? Okay, I will tell you now. Listen, the thymus is an endocrine gland. It's going to produce an hormone called the thymosin. You don't care about that. But what happened is this. Thymus is going to be where the lymphocytes T are going to get mature. They get mature. All right. So now I want you to explain me why happened rheumatoid arthritis. What happened sclerodermia? What happened psoriasis? What happened myasthenia gravis, multiple sclerosis? What happened with lupus? All we happen with diabetes type 1. All these are called autoimmune disorders. Autoimmune disorders. So why is that? Now look at this. The thymus, you're going to mature the lymphocyte T. So you are the lymphocyte T. Imagine that you are the lymphocyte T. Okay, you are lymphocyte T right now. Okay, so your room is going to be the thymus. Your room is the thymus. Now I want you to have a homework. I want you to go out of the room, out of the thymus, and try to recognize everything around you. Oh, this is my TV. Oh, this is my chair. Oh, this is my fork. This is my spoon. This is my plate. This is my whatever, light, whatever, everything. The table mat. This is my soap. This is my toothbrush. This is everything. So you're really recognizing every single centimeter of your house. Your house is your body. Your room is the thymus. You are the lymphocytes T. Get out of your room and try to recognize everything and memorize that. So these lymphocytes are an immune system. So that means that's why you are not being attacked by your immune system. Why? Because these lymphocytes T are recognizing which cell belongs to you. And that happened in very stage of life, in fetal life. They're going to come out and they're going to recognize, oh, this is mine, this is me, this is me, this is me, this is me. So now they are able, when somebody strange coming into the body, they're going to recognize this is not our body. We need to kill them. And that is where the immune system is going to participate. Okay? We okay with that? Now, what happened with these autoimmune disorders? Diabetes, psoriasis, etc., multiple sclerosis, myasthenia gravis, whatever. So what happened is we don't know when and how. There is a moment that these lymphocytes T are going to lose the memory. They're going to lose memory. They become amnesic. They say, oh, where I am, where is it? What is this? Oh, I know you. Yes, I'm part of you. No, I don't know you. I need to kill you. Sorry. And some autoimmune disorders are going to be more sensitive, for example, in the joints, destroying the joints. That is rheumatoid arthritis. In some moment of the life of that person, the lymphocytes, they lost the memory. They lost the memory. They cannot remember who is your body, and they destroy you. For example, rheumatoid arthritis, the joints. For example, lupus are going to destroy the kidney, all skin and kidney, basically. The psoriasis, somebody you know with psoriasis, somebody, is destruction of the destruction of the skin. Your immune system is attacking your own skin. Very bad, right? So, and that is what we call autoimmune disorder. And the thymus is going to be that organ, the endocrine gland. Arby, you very serious. You're traveling with me in your imagination, yes? No, yes. Try to travel. Okay. Come on. Oh my God. Okay. Guys, it's 10 minutes to 7. Can we have a break, 10 minutes? Okay. I will
Yes.
see you at 7.
Okay.
Muchas gracias. Muchas gracias. I'm going to keep killing the meat. Okay. See you then. It's time? Oh, no, not yet. One more minute, right?
Give me this everything. Everything. A glass too.
One glass. There's no other. Oh. Oh, I didn't know I got it. Thank you. Okay, are we ready? Okay. I want to be clear on one thing. Cameras, please. Is that the connection that we have with the nervous system and the endocrine system. I will give you one example to start with all the in detail. When you are dehydrated, tell me, you pee less or you pee more?
Less.
Less.
Less. Excellent, right? Excellent. Why do we pee less? Right? If you are dehydrated, why you pee less? Now, let's start. Who knows that you are dehydrated?
Hypothalamus.
The hypothalamus.
Hypothalamus, right? So the hypothalamus is aware now that you are dehydrated. Hypothalamus is, again, nervous system. Don't forget that ever, but I'm not going to repeat. So already, okay? Hypothalamus nervous system. So it's aware. It's the thinker. It's the big gossiper. And this guy is going to send orders to the pituitary gland. So sending orders to the pituitary gland, they are going to secrete. They said, okay, we are dehydrated. Okay, pituitary gland. So hypothalamus called the pituitary gland and tell the pituitary gland, you know what? We are dehydrated. We need to do something. And this pituitary gland, what it's going to do is to secrete an hormone. The pituitary gland secretes an hormone. This hormone is called the antidiuretic hormone. Antidiuretic hormone. Antidiuretic hormone. This antidiuretic hormone is, first of all, you need to know what is the word diuresis. Diuresis, medical terminology. Diuresis means production of pee, urine. Okay, diuresis, for example, you take diuresis, for example, alcohol. Alcohol is a diuretic because alcohol makes you pee more, yes or no? Right? Now,
Yes.
you are dehydrated, so there is an hormone called the so the opposite of diuresis, antidiuretic hormone. So based on the knowledge of the hypothalamus that we are dehydrated, they are going to send an order to the pituitary gland to secrete the antidiuretic hormone. The antidiuretic hormone, they go to a target organ. Remember, we was talking about the name of the hormone, the target organ, and then the target organ of the antidiuretic hormone will be the kidney. And what is the function? The function will be to retain urine, to reabsorb more water. So why? Because your body is dehydrated. So you try to keep all the water possible in order to keep the homeostasis of water. Okay with that? So the name of one more time, name of the hormone, target organ, and the function. Okay, name, target, and function. NTF. Name, target, and function. Name, target, and function. Name, target, and function. Name, target, and function. Okay, so that is what it's doing basically in general. All right. So now we are going to talk about the axis. The axis. So the axis, let me see what is in the slide. I start to do lecture without slides. Huh? Okay. Okay, let me see. me see if I have another. Oh, there you are. That could be an example. Okay. So what are the target audience? Okay. So let's start. All right. So the target audience. Let's start. All right. So Deborah, you're going to be the hypothalamus. Okay. You're in the first row, right, on my screen. Can you see that? Okay. And then the second row is going to be Sophia, Tom, Chelsea, Wina, Mark, Lisbeth. And the second row will be, let's see, the pituitary gland. Who is below, under you, Deborah? The pituitary gland. So that is Wina. Okay? Deborah, your name now is hypothalamus. You are the big gossiper. Okay? And Wina is the pituitary gland. That is below you. Okay? Okay. Let's start. So let's go to Catherine. Catherine, sorry, correct me your name, please. Catherine is okay? Okay, Catherine. Catherine will be the muscles and bones. Who you are, Catherine? Muscles and bones.
Muscles and bones.
Excellent. So when I said muscles and bones, you raise your hand for 3 seconds and then go down. Okay, everybody. When I said hypothalamus, you raise your hand, Deborah. When I said pituitary gland, you raise your hand, Wina. All right. When I said muscles and bones, you're going to raise your hand, Katrina. Okay. Now, Arby. Oh my God, my eyes. Miss Arby, you're going to be the breast. Who you are?
The breast.
The breast. And you're going to raise your hand like this 3 seconds and then go down when I say breast. Alejandra, you're going to be the thyroid gland. Thyroid gland. Okay, you are the thyroid gland. Who you are, Alejandra? Alejandra.
Oh my God.
Oh my God. Okay, you don't want to participate? No, I can hear your microphone. You can talk. And I heard you say, oh my God.
No, can you hear me
Uh,
now?
Yes, I can hear you. That's
Oh,
okay.
it's because it
That's
says
okay.
turn on microphone and then it says turn off microphone. So I was like, which one is it?
Okay.
Yeah.
All right. Okay, so I'm not pushing anybody to participate if you don't want it, okay? All right. So, Tashi, you're going to be, let me see, you're going to be I said the thyroid gland. Thyroid gland. You're going to be thyroid gland, Tashi, okay? Who you are? The thyroid gland. And I said, oh no, this is me. Let's go another, all right, so let's do those. All right, so now, the hypothalamus is going to, raise your hand, hypothalamus, 3 seconds and go down. Hypothalamus is going to communicate to the pituitary gland. And the pituitary gland is going to communicate with the muscles and bones. Excellent. So that pathway that you just saw are going to be the hypothalamic pituitary muscle bones axis, AXIS. Okay? Now, there is another axis. That axis is going to be the hypothalamic, pituitary, I said pituitary, mammary gland. I said mammary gland, Arby. Your hands up. Okay. All right. So that axis is called the hypothalamic pituitary mammary gland axis. Okay with that? Now, let's go. Hypothalamic pituitary thyroid gland axis. There you are. That is a pathway. That is another axis. Okay? So now, let's thank you for that. Let's start this. What happened with the thyroid gland is not working when you have hypothyroidism. When the thyroid gland do not produce the hormones T3 and T4. When the thyroid gland do not produce the T3 and T4. All right, so where is the problem? The problem will be the thyroid gland. Thyroid gland. Thyroid, touching, thyroid gland. Excellent. Okay, but let's suppose that the thyroid gland is working normally. Let's suppose the thyroid gland is working normally. If you have hypothyroidism, and the thyroid gland is not the problem, who can be the problem? The problem could be the pituitary gland. The pituitary gland. Now, if the thyroid gland, you're still having hypothyroidism, and if your thyroid gland itself is working normally, and your pituitary gland is working normally, who can be the problem? The problem will be the hypothalamus. Excellent. So we have three levels. When you have a deficit of something, those are the three levels that they need to investigate. If you have hypothyroidism, they're going to check if your thyroid gland is working, or if your pituitary is working, and your hypothalamus is working or not. You okay with that? Okay? And the same thing happened with other hormones. Let's make another round. Let's see. I would like to have the rows, but anyhow. Catherine, you are going to be now. You're going to be the adrenal gland. RB, you're going to be the ovary. And Alejandra, you will be the uterus. Okay? So here we have, for example, the adrenal gland is the one who produces the cortisol. Okay? So it's the stress hormone. This cortisol, this adrenal gland are going to be called, the axis will be called the hypothalamic pituitary adrenal gland axis. Thank you. The hypothalamic pituitary ovarian axis. Excellent. And the hypothalamic pituitary uterine axis. Alejandra, your hand.
Oh.
Gracias. Okay? All right. So that is actually the three levels. Now that you know that the pituitary gland produces all these elements, okay, you need to remember the name of the hormones, the target organ, and the function. And that is what we are going to do right now. Okay? All right. Let's start. Oh, okay. We need to remember a few things before that. Okay. I'm going to try to write down a small or nice in order to be clear. All right. So here we have the hypothalamus. The hypothalamus is going to be the big gossiper. Now, hypothalamus is going to be sending orders to the pituitary gland. Are going to be called the master gland. Or called, and you try to memorize right now, the hypophysis. Yeah, I know there's different There's a lot of names, but that's what it is. Hypophysis. Okay, so now we have the master gland, pituitary gland, or master gland, or hypophysis is the same. Hypothalamus is hypothalamus. Then these guys are going to divide. The pituitary gland are going to be divided itself. The pituitary gland is like this, something like that, like a pedicle here. So this portion is the anterior and this is the posterior. So we have two components of the pituitary gland. We have the anterior pituitary gland, anterior, and you need to remember this name, or called the adenohypophysis. Adenohypophysis. And we have another one that is called the posterior pituitary gland. I'm going to be anterior pituitary gland. We have the posterior pituitary gland, or called the neurohypophysis. Okay, the neurohypophysis. Everything is written in the PowerPoint. All right, so let's start with the hormones that secrete the adenohypophysis. Number one, we are going to talk about the name. So all these hormones are going to be produced by the anterior or adenohypophysis. How to remember? A anterior, A adenohypophysis, AA. Adenohypophysis and anterior pituitary gland. The posterior pituitary gland is called the neurohypophysis. You need to remember that. So the first hormone that we are going to talk, the name, is going to be the growth hormone. Growth hormone. This growth hormone, the other name that you need to remember, I'm sorry, but it's a must, is the somatotropin hormone. Medical terminology, simple. Somatotropin hormone, somato means body, tropin, growth. So growth hormone is the one of the hormones. So what is the target organ? The target organ will be the muscles and bones. I'm going to delete this just to do later because it's obstructing my vision. And here we have the function. The function will be growth. Simple, right? Another hormone that we need to remember is the prolactin. Try to memorize right now on the spot. Prolactin. The prolactin is going to be having a target organ, the breast. And what is doing the prolactin in the breast is going to do I want you to repeat exactly what I said, please. Production of milk. Production of milk. How to remember? Very simple. Prolactin, production of milk. You will understand why I'm trying to make emphasis on that very soon. Prolactin, breast, target organ, the function is the production of milk. Then we have the thyroid stimulant hormone. We call the TSH. Who produces the TSH? Is the anterior pituitary gland or adenohypophysis. What is the target organ? The target organ will be the thyroid gland. So please, don't get confused. The thyroid gland do not produce TSH. It's the TSH who stimulates the thyroid gland. It's coming towards the thyroid gland. The thyroid gland do not produce TSH. TSH is the memo, is the order coming from the pituitary gland towards the thyroid gland. And what is doing the TSH on the thyroid gland are going to produce T3 and T4. Okay? Then we have another hormone that is called the adrenocorticotropin hormone. And we are going to call by short the ACTH. Is the ACTH, the adrenocorticotropin hormone. And what is the target organ? Is going to be the adrenal gland cortex. And what is the function? Basically to produce cortisol. What is cortisol? Cortisol is the stress hormone, correct?
Correct.
Okay. So now, then we are going to have the lutein hormone, the L-lutein hormone, that is called the LH. Lutein hormone, LH. And what is the target organ? Is going to be the ovary. And what is the function of the LH in the ovary? Is the ovulation. The last hormone are going to be the follicular stimulant hormone. That is going to be called the FSH by short. FSH. Who is the target organ? The ovary. And what is doing in the ovary? Production of estrogens. All right. Prorate final exam. There is a lot of questions about this. Potentially you have 1, 2, 3, 4, 5, 6. 6 hormones in the anterior pituitary gland, 6 hormones, multiplied by 3 is 18. So potentially we have 18 questions here in this slide only. You okay with that? All right. So now, looks like it's a lot of work. Probably yes. Look at this. How many hormones we have in the anterior pituitary gland?
6.
6. And that is basically the mnemonic. G, P, tal, F. GP tal F. G, P, tal, F. Can you repeat GP tal F, please? 3 times.
GP tau F.
GP tal F.
F. GP tau F.
GP tal F. GP tal F. Okay. Give me the G. Who is G?
Growth hormone.
Everybody, please. Growth hormone.
Growth.
Give me the P.
Prolactin.
Give me the T.
Lactin.
You can
Thyroid.
Thyroid.
thyroid stimulant hormone. So you can tell me the TSH. TSH. Give me the A.
ACTH.
Okay, everybody repeat with me. Adreno,
Adrenal.
cortico,
Cortical.
tropin. Hormone.
Tropin.
Now tell me again. Adrenocortico, tropin hormone. Now tell me again. Adrenocorticotropin hormone.
Adrenocortical hormone.
Now who can say that faster? Adrenocorticotropin hormone, adrenocorticotropin hormone, adrenocorticotropin hormone, adrenocorticotropin hormone.
UN.
Go ahead. I want to hear. Harvey. Everybody, come on. Faster.
Adrenocortical.
Excellent. Okay. Some of you don't talk, right? Okay. All right. So ACTH. Then we have, give me the L, the lutein
L.
hormone or the LH. Give me the F, is going to be the FSH. FSH. We okay with that?
Yes.
Yes.
Okay. So those are the 6 names of the of the hormones produced by the adenohypophysis or anterior pituitary gland. That are the 6 names. Let's go to the target. What is the target of the growth hormone?
Muscles and bones.
Muscles and bones. What is the target of the prolactin?
Breast.
What is the target of the TSH?
Thyroid. Thyroid gland.
What is the target of the ACTH?
Adrenal gland.
Adrenal gland cortex. What is the target of the LH?
Ovary.
What is the target of the FSH?
Ovary.
Ovary.
The ovary. All right, one more time. Growth hormone have a target organ, muscles and bones. What is the function of the growth hormone on the muscles and bones?
Growth.
Growth. We have the prolactin, target organ is the breast. What is the function of the prolactin?
Production of milk.
Production of milk. We have the TSH that is going to stimulate the target organ, thyroid gland. What is the function of the TSH on the thyroid gland?
T3.
To produce T3 and T4. We have the ACTH. The ACTH are going to be having as a target organ the adrenal gland cortex. And what is going to produce?
Cortisol.
Cortisol. We have the LH. The LH target organ is the ovary. What is going to do in the ovary? Ovulation. And the FSH, the target organ again is the ovary. What is going to, what is the function?
Estrogens.
To produce estrogens. So how you remember that? With the GP tau. GP tau, name, target, and function. Name, target, and function. How many hormones we have in the anterior pituitary gland? 6 hormones. Just remember, very common mistake on the students is to say that TSH is produced by the thyroid gland. You have 0 in that question. Don't lose points for nothing. The TSH is produced by the pituitary gland. The TSH is going to go to the thyroid gland, and the TSH is telling the thyroid gland to produce more T3 and T4. Okay with that?
Yes.
Okay. So that is the target organ. So here we have, I'm going to put here, the other one is the posterior pituitary gland. Posterior pituitary gland, or called the neurohypophysis. Please don't lose points for nothing, okay? The neurohypophysis. We okay with that?
Yes.
Okay. So now, how many hormones we are going to have in the posterior pituitary gland? The posterior pituitary gland are going to have only 2 hormones. We have here the posterior, we are going to put the posterior pituitary gland below here. The posterior pituitary gland are going to have 1 hormone called the oxytocin. What is the target organ of the oxytocin? It's going to be the breast. The breast. And what is doing in the breast? In the breast are going to produce the ejection of milk. So that's why I was telling you prolactin, production of milk, oxytocin, ejection of milk. Okay? You got it? The other function of the oxytocin, they have 2 target organs. The oxytocin is going to stimulate the uterus. And what is going to happen with the uterus is uterine contraction. So basically the labor. And the other hormone, and the last one, is going to be the antidiuretic hormone. The antidiuretic hormone is called the ADH, antidiuretic hormone. And that is going to be, target organ is going to be the kidney. And what is going to do? Reabsorb water. Okay? So that is a must that you need to remember for your exam, final exam. Okay? So review that. You must know this very well. We okay with that?
Yes.
Yes.
Okay. Any question, please? Any question?
No.
I don't have it. Okay. Okay. So now what I want to do is I want you to close your books, your everything, and you will tell me by heart. Okay? All right. Everybody, please, look at me. Let's start with the first one. What is the first one of the adeno hypothesis? Everybody.
Growth.
Growth hormone.
Growth.
And the growth hormone are going to, what is the target organ?
Muscles and bones.
Muscles and bones. And then function is the,
Growth.
Growth.
so you're going to tell me growth hormone, muscles and bones, growth. Then what is the next one?
Prolactin.
Prolactin.
Leptin.
Keep going.
Breast.
Breast.
Brain.
Production of
Production of milk.
Production of milk.
Got it? So prolactin, breast, production of milk. Prolactin, breast, production of milk. What is coming? What is next?
thyroid. Oh, thyroid.
Thyroid stimulant hormone.
Is the TSH, correct? Now, the TSH, what is the target organ?
Thyroid.
Thyroid gland.
Thyroid gland. And the function, produce
T3 and
T3 and T4.
T3 and T4. What is next? The A,
Adrenocortical.
adrenocorticotropin hormone, the ACTH. And
Yes.
the target organ is
Adrenal gland.
Adrenal
adrenal
gland.
gland. And the function is to produce
Cortisol.
Cortisol.
cortisol. We have, what is the next one? L,
LH.
LH
Lutein or
is the lutein hormone. Target organ,
Ovaries.
function,
ovulation.
Ovulation.
ovulation. The last one,
FSA.
FSH,
Ovary.
Ovary. Estrogen.
There you are. So you can GP it out. Growth, bone muscles growth. P, prolactin, breast, production of milk. TSH, thyroid gland, production of T3 and T4. ACTH, adrenal gland, production of cortisol. LH, ovary, production cause the ovulation. FSH, the ovary, production of estrogens. How long is taking us to say that? Probably 10 seconds. GP F. We okay with that? Now we have the that is who produced these hormones? The adeno hypophysis or the neuro hypophysis?
Adeno.
Adrenal.
The adrenal hypophysis.
Adeno hypophysis.
No.
I call that
Post.
Anterior pituitary gland.
no A. A is adeno. A means anterior.
Anterior.
AA. ¿Me qué vida? Okay. The posterior pituitary gland. We have the oxytocin. What is the target organ?
The uterus.
Okay. The uterus and produce
Contractions.
contraction. What is the other target organ of the oxytocin?
Breast.
Breast. What is going to cause?
Injection
Ejects
of
milk.
milk.
Ejection of milk. And the last one. What is the last one?
The antidiuretic.
The antidiuretic hormone. The ADH. Target organ. Kidney. Function.
Reabsorbs water.
Absorbs water.
Reabsorption of water. Who produce these hormones? The neurohypophysis. The posterior pituitary gland. All right, so last time. Growth hormone, muscles growth. Prolactin, breast production of milk. TSH, thyroid gland, T3 and T4. ACTH, adrenal gland, cortisol. LH, ovary, ovulation. FSH, ovary, estrogens. Posterior pituitary gland, neurohypophysis. Oxytocin, breast, ejection of milk. Oxytocin, uterus, contraction of the uterus. ADH, kidney, reabsorption of water. That's it. That's it. You okay with that?
Yes.
Yes.
Okay.
Yes.
So I'm doing the extra mile. I'm trying to memorize a study with you guys. So I give you the frame. So you just need to repeat it and master that. Okay? All right. So please do competition between you because that is bread and butter. What is coming later in the courses. Salud. Where is my PowerPoint? Oh, here. Okay, so that is about. All right, so let's do the decorations now. I got this mouse is killing me. Okay. We have other hormones that we are going to see in a few moments. Okay, so now let's go for the third time, or fourth time, I guess. The pituitary gland is called the master gland, or called the hypophysis. It's very clear there. The division of the pituitary gland is going to be the anterior and the posterior pituitary gland. So I'm going to make it bigger here. I don't know why they put it upside down, but anyhow, I'm going to try to do this. I have my picture, I guess, somewhere like that. Okay. All right, so this is, okay, so the patient is looking for this. This is the eye, this is the nose. Okay, okay. No, the nose is not too high. The eyes are going to be here and the nose here. All right, so this is the pituitary gland. That is the anterior, and this is the posterior, according to this graphic. And here we have the hypothalamus. So you see here, the pituitary gland is going to release the GPTAL. G, growth hormone, P, prolactin, T, TSH, A, ACTH, FSH, and LH. And the MSH is basically, you don't want to remember. If you want to remember that, it's okay. Are the melanocytes. Melanocytes are those cells who are doing the pigmentation of the skin. Okay? All right. All right, so here we have the posterior and anterior pituitary gland. Anterior pituitary gland is called the adenohypophysis. Adenohypophysis. That's it, what I want you to know. The posterior pituitary gland are going to be the neurohypophysis, is the oxytocin, and they're going to eject or release the milk. It stimulates the uterine contraction during your delivery, during your labor. ADH or antidiuretic hormone are going to stimulate the kidney to reabsorb water. All right, so let's go to the next level. Right now, you need to remember that question for the exam. Very clear, I'm telling you, don't lose points for nothing. The growth hormone is called the GH or the somatotropin hormone. Somatotropin hormone. Somatotropin hormone. Somato means body, tropin means growth. So somatotropin hormone, the growth hormone. All right. For the exam, you need to remember some deficits and excess of the hormone. If you have deficit of the hormone, you have dwarfism. That is when it's happening in children. When it's in children, happening in children, that is called the dwarfism. How much is the height of a dwarf or a person who is suffering with dwarfism? Is going to be 4'8". 4'8" or less. That is, we start consider that dwarfism. You okay with that?
Yes.
Simon's disease, thank you. Simon's disease, when you have the deficit of growth hormone in adults, what they're going to do is they're going to get wasting of tissues. So that's especially the muscles. The muscles are become very thinner. So the deficit of growth hormone in children is different from the deficit of hormones in adults. That you need to know the proper name. Simon's disease. Simon's disease in adults. Dwarfism in children. Now, we have excess of growth hormone. The excess of growth hormone, you need to remember two names, gigantism and acromegaly. Gigantism and acromegaly. Gigantism happen in children, and acromegaly happen in adults. What is the difference between these two? Is that the gigantism, basically all the long bones of your body are going to be longer. The femur, the humerus, the fibula, the tibia, the radius ulna, all are going to be very long, very long. That is in children. But once you are already grow and you start to have excess of growth hormone, what they're going to be enlarged are not going to be the long bones, are going to be the small bones, like the carpal and the tarsal bones of the feet and the hands. So that is going, and the jaw, you have a very prominent jaw that is actually caused by this acromegaly or excess of growth hormone. Okay?
Yes.
Okay. Now the thyroid gland, the thyroid gland is going to receive orders from the TSH. Another name that you need to remember, so I'm going to put here, thyroid gland is produced, this we need to correct here a little bit. Thyroid gland produce T3 and T4. Now, the T4 is called the thyroxine. T4 is thyroxine. Question for the exam again. The T4 is the thyroxine. So who is the T4? Thyroxine. What is thyroxine? The T4. Okay? And what they are going to do, production T3 and T4, they are going to go into the cell to produce ATPs. That is what is doing the T3 and T4. The more T3 and T4, the more ATPs probably you will need. And the less T3 and T4, when you are couch potato 2 weeks not doing anything, your metabolism rate go down. So that who knows that? The hypothalamus. So the hypothalamus, what is going to do? Oh, you are a couch potato. Okay, you don't need that much energy. Okay, so keep silence. Do not tell anything the pituitary gland. And the pituitary gland are going to just follow orders. But that doesn't receive any order because the hypothalamus knows that you are resting. You are not demanding ATPs. Okay with that?
Yes.
Okay. So now, I'm going to talk about the thyroid gland. The thyroid gland, oh, by the way, where is the thyroid gland? Somebody can tell me.
In the throat.
Can you show me where is the thyroid gland? I want to see your neck, please. Everybody's neck. Okay. All right. So show me with one finger where is your thyroid gland. Okay. Okay. All right. So, Jasmine, is the larynx or the thyroid gland? We are going to know that now. Excellent. Very good. I want you to touch your Adam's apple. You know what is your Adam's apple? In male, is more prominent than female. The Adam's apple, the hardest portion. Now, from the hardest portion, you're going to put two fingers down. Side by side, that is the thyroid gland. The palpation is like this. From behind, we are going to, if I will be in class, I will teach you how to do it. So take a note, Deborah. And your clinic, tell them, the clinical, how to check the thyroid gland. How to check the thyroid gland, okay? So everybody take notes and clinical. So when you have a break, you say, please, Dr. G is asking just to, if you please can show us how to check the thyroid gland, okay? All right. So now, touch your thyroid gland. Touch your thyroid gland. Tell me, who can feel your thyroid, the thyroid? Who can feel it? Do you feel it? Somebody can feel the thyroid gland. Can you feel it or no?
No.
Lisbeth, can you feel
Yeah.
the thyroid gland? Who can feel it? Okay, Lisbeth, I'm going to. Very good. Okay, Miss Lisbeth. So who can palp the thyroid gland? One, two, how many? Very good. Why? Because the thyroid gland is not palpable. You cannot palp the thyroid gland. The thyroid gland is not palpable when it's normal. When it's abnormal is when you can palp the thyroid gland. So I will tell you, you need to go from behind, put your two fingers like this. That is the way to palp the thyroid gland from behind, at the level of the thyroid gland, and then you ask the patient to swallow. Swallow. See, and the larynx is going to go up and down. And when they go up and down, are going to pass under your fingers if there is some enlargement or not. Okay? Okay. So that is the thyroid gland. Now, who like to make cakes? Tachi, you like cakes? No, you don't like cakes? Oh, okay. Arby, you like cakes? Excellent. See? Okay. All right. So to make a cake, you need ingredients, correct? Right. Right. Okay. Now, exactly the same is happening with the thyroid gland. Listen to this very careful, please. The hypothalamus is going to send orders to the pituitary gland, right? Because we want to have more T3 and T4, right? So the pituitary gland are going to release TSH. It's the pituitary gland who releases TSH, the anterior pituitary gland, or adenohypophysis, and this TSH go to the thyroid gland. The thyroid gland receive the order to produce T3 and T4. T3 and T4. But the thyroid gland, they need ingredients to prepare the cake. The thyroid gland itself, they need ingredients. This ingredient is going to be the iodine. It's going to be the iodine. The iodine. Let me check here. So here we have the hypothalamus. They're going to go the pituitary gland. The pituitary gland is going to send the TSH, and the TSH go to the thyroid gland. So in order, so this is the order. I want cake. Need cakes. That is what it's telling the TSH. Need cakes means need T3 and T4, correct? So it's the TSH who stimulate the thyroid gland that is going to produce T3 and T4. T3 and T4. T3 and T4. T3 and T4. Okay? T3 and T4, whatever is your T3 and T4. So they are going to produce that. But what is the ingredient of the thyroid gland to produce T3 and T4? The ingredient of the thyroid gland is the iodine. 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 This iodine, when the TSH arrive to the thyroid gland are going to capture iodine, 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 iodine. And that is the ingredient for the thyroid gland to prepare the cake. That is the T3 and T4. You okay with that?
Yes.
Yes.
Now,
Yes.
one more thing. Why is called T3? Why is called T4? What is the other name of T4? What is the other name of T4?
Thyroxine.
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 All right. So you know why it's called T3? Why? Because the molecule is going to contain this. Three iodines. Why is called T4? Because they have 4 iodines. That is how the thyroid gland is going to work. Okay? We okay with that?
Yes.
Okay.
Wait, so T3 doesn't have a name?
T3 doesn't have what?
So T3 doesn't have a name like T4?
Oh, yeah. No. The T3 is the triiodotyrone. Triiodo. Tri means 3, iod means iodine. 3 iodine. That is the T3. The T4 is the tetraiodine. So, but more probably called thyroxine. In NCLEX, HESI, any exam, they don't ask you about the triiodotyrone. So that's why I didn't remark on that. Okay? Yeah, but they have a name, the 3 and the tetraiodotyrone. All right. All right, so that is about the thyroid gland. Let's talk about the hypothyroidism. So in hypothyroidism, you're going to have in children, they're going to produce the cretinism. Cretinism. You can write down in your PowerPoint or in your paper, cretinism means already mental retardation. Mental retardation.
Dr. G,
Oh, yes.
are we going to get a lunch break?
Yes, at what time?
Oh, no, I was just asking, are we?
Yeah. You want lunch break now? I'm tired too.
Yes, please.
Sure. All right, so I will give you until 8:25.
Sounds good.
All right, so let's make a break here. I'm going to have my lunch now too. Okay, Arby, any question? No? Chelsea?
No, Dr. G. Yes.
Okay, miss. See you then. Hello? Okay, let's continue, please. Okay, so we was talking about the cretinism of the hypothyroidism. Cretinism, please, I want you to write down that is going to be mental retardation, mental retardation. Oh, sorry, my screen, right? Finally, remember the screen. Okay. In your PowerPoint, you're going to write down here, cretinism is going to lead into mental retardation. Mental retardation. Okay, why is that? Because this is in children. So this is a newborn where the mother didn't have actually ingestion of iodine. No iodine in her diet for whatever reason. So this iodine, so the fetus is going to develop his thyroid gland at 10 weeks of gestation. 10 weeks of gestation. So it's going to be 2 months and a half. If the thyroid gland starts to work, and the mother do not pass through the placenta barrier, cannot pass the T3 and T4, cannot pass. So what is going to pass is the iodine. The baby is going to produce her own T3 and T4, not from the mother. And for that, the baby needs diet iodine. The mother is going to take iodine. If the mother doesn't take iodine, the baby cannot produce T3 and T4 in the fetal stage. And the fetal stage, you need a huge amount of energy to produce cell division. And the one who is going to be mostly affected, basically, is the nervous system, the central nervous system. And the baby is going to born with less number of nerve cells. And that is going to be an irreversible mental retardation. So it cannot recover from that. It can, the maximum, whatever, 99.9%, but never is going to be as supposed to be. Okay, normal. You okay with that? That is called cretinism. Okay, so goiter is going to be caused by iodine deficiency. So if the person doesn't eat iodine, what happens is the thyroid gland that is this size are going to get enlarged. Why they get enlarged? Why? Because they want to increase the size of the thyroid gland in order to increase the absorption of the few iodines that are still in the bloodstream. So that's why the thyroid starts to enlarge. Okay, so that's because of the deficiency of iodine. The number one cause of goiter, that is called goiter, is in the world is going to be iodine deficiency. Iodine deficiency. In the United States, in the 40s, in the 50s, there was a lot of people with big goiter walking on the street with big neck. And what they did after that is this. They put iodine in the salt. Salt is what we use every single day. And they put iodine in order to limit this situation. And basically, you don't see anybody with iodine deficiency. We have hypothyroidism in the United States. Yes, we have hypo, but it's another cause. You will see later on, this is the Hashimoto disease. This is not your time to know about that. Okay? So basically, that is the base. Okay, we okay with that?
Yes.
Yes.
Okay.
Yes.
Excellent. So now let's. Would you please give me 10 minutes after 9, please? Okay. Please.
Okay.
Okay. All right. So we are going to talk about the thyroid gland. Again, yes. The thyroid gland are going to produce 3 hormones. I said 3, yes, 3 hormones. The T3, the thyroxine, or T4 thyroxine, whatever. And the other one is, remember this, is the calcitonin. Calcitonin. This is a little bit tedious, but actually let's try to make it easy. Calcitonin. All right, so one big difference, please pay attention to that. We have the hypothalamic pituitary gland, thyroid gland axis that produce T3 and T4. So these guys. But the calcitonin is produced, yes, by the thyroid gland, but it's not going to follow the hypothalamic pituitary gland. It's not going to follow the hypothalamic pituitary gland. Calcitonin is the third hormone of the thyroid gland, and the calcitonin have a very important function. Now, calcitonin is going to basically regulate the levels of calcium, serum calcium concentrations. Serum calcium. What is the concentration of calcium? You already know, question for the final, 8.5 to 10 milligrams per deciliter. So that deciliter, that's happening in the morning too, exactly the same. That makes it. Okay, so deciliters, 8.5 to 10 milligrams per deciliter. Okay, and why do we need calcium? Remember this? Remember this or not? Please.
Yes.
Right? And that is going to be what is happening in the contraction and relaxation of the smooth muscle, striate muscle, cardiac muscle, and the electrical impulse, the nervous system, electrical impulse. So we need calcium on that. And for that, this, in order to occur, a smooth striate cardiac and nervous system occur normally, you need to have this range, 8.5 to 10 milligrams per deciliter. Okay?
Okay.
Okay.
Yes.
Now, what is doing the calcitonin? The calcitonin is going to be released by the thyroid gland if calcium is higher than 10 milligrams per deciliter. Again, okay, per deciliter. Okay, so when calcium is too high in your blood, what it's going to produce is muscle relaxation because it's totally jammed here. It's so jammed that the neck contraction do not happen. So that's why we have too much calcium. So what is doing the calcitonin is this. Calcitonin is going to remove the excess of calcium from blood. And where they go, where they put it? They put it into the bones. Yes, when you have excess of calcium, you don't want excess of calcium. So that, listen to this, please. That excess of calcium is the stimulus for the thyroid gland to produce calcitonin. Is the high levels of calcium in blood who stimulate the thyroid gland, who tell the thyroid gland to produce calcitonin in order to take out that excess of calcium from the blood and put it back into the bone. You okay with that?
Yes.
And who is doing that? Basically, the calcitonin, when you have, okay, so when you have, I'm going to put it here, when you have high calcium, more than 10, that is going to go to the thyroid gland, and the thyroid gland produce the calcitonin. The calcitonin, what it's doing is going to go and activate the osteoblast. And you know what is in the previous classes, activate osteoblasts. And these osteoblasts are going to take that excess. But what is the function of the osteoblast? The action of the osteoblast is to deposit calcium in the bones. Calcitonin. We okay with that? Is clear or not, please?
Yes.
Yes.
Excellent. Now, we have another gland I'm going to show you here. This is not a very nice picture, but basically what we have is the parathyroid gland. This is the parathyroid gland. This is one parathyroid gland, another parathyroid gland. We have another parathyroid gland, and we have another parathyroid gland. So we have average 4 parathyroid glands. We can have 6, we can have 8 parathyroid glands. These parathyroid glands are just behind. It's like somebody get laid on you from behind. So you are the thyroid gland, and the person from behind is going to be the parathyroid gland. So that means that the parathyroid gland do not belong to the thyroid. So the parathyroid gland are going to be very close, so over the thyroid gland, but doesn't actually be, they are totally different glands. Okay? All right. So this parathyroid gland, they have the opposite function of the calcitonin, opposite calcium of calcitonin. Number one, parathyroid gland do not follow the hypothalamic pituitary gland axis. So we didn't mention, right, in the previous, we didn't mention parathyroid gland. So parathyroid gland is not following that axis. Hypothalamus, nothing to do with this. So who stimulate the parathyroid gland that is going to produce the PTH? PTH is the very simple parathyroid hormone, the parathyroid hormone. So the parathyroid gland are going to produce the parathyroid hormone or the PTH. The PTH. So what is doing the PTH? When is going to the parathyroid produce the PTH? The PTH is going to be produced when the calcium is lower than 8.5. Remember the same chart that we was talking before. Sodium, calcium, that is needed for the contraction of smooth, straight, cardiac muscle, and nervous system. So when the calcium is too low, actually you want to keep it into 8.5 to the range of 10. That is the normal range. But it's too low here, it's too low. These low levels of calcium stimulate the parathyroid gland to produce the PTH. And what is doing the PTH? The PTH is going to activate the osteoclast cells, the osteoclast. What are doing the osteoclasts? Are being removing, they're going to remove calcium from the bones and put it back into the blood. And now they're going to reach the 8.5 to 10. Is that clear?
Yes.
Everybody's clear on that? That is question for the exam 100 times, huh? Okay. Now, all this process, the calcitonin and PTH, that is what we call the calcium homeostasis, to keep the internal balance of calcium. Homeostasis to keep the internal balance of calcium. Who is doing that? Between the calcitonin and the PTH. All right, so is that clear? Let's continue.
Yes.
Okay, so here, thank you. Homeostasis here of blood. So we have high calcium. High calcium, they are going to stimulate the thyroid gland to produce calcitonin. And calcitonin, what is doing, high calcium in blood, they are going to, calcitonin, get the calcium and put it back into the bone. So means that it's taking the excess of calcium from the blood and put it back into the bone. Now, if the calcium is low, stimulate the parathyroid gland to produce the PTH. The PTH activate the osteoclast. the osteoclast, and the osteoclast remove calcium from the bones and put it back into the blood in order to reach the 8.5 to 10 milligrams per deciliter. Okay? Okay. So now let's talk about the adrenal gland. Adrenal gland. Adrenal gland. So this is very important. Okay. So basically, all the time that we are going to spend is here. All right. So we have the adrenal gland. I'm going to do the adrenal gland. The adrenal gland. There are two adrenal glands. They are located on the upper pole or superior portion of the kidneys. Each kidney on the top, they have adrenal gland. The right adrenal gland and the left adrenal gland. Right and left adrenal gland. Now, let's talk about the adrenal gland and let's cut it. I think I'm going to show the picture that I have here better. Here, we have here cut the adrenal gland. This is the kidney. On the bottom here is the kidney. And let's cut the adrenal gland in half like a fruit. So we have two components. We have the cortex. All this is the cortex, all the lines you see there. And we have the medulla, very important. This is huge. So please, medulla. So the cortex, what they are doing, what are going to produce are three hormones. Number one hormone is going to be the cortisol. Number two is going to be the aldosterone. And number three, the sex hormones. Estrogens, progesterone, and testosterone. Okay, so don't get confused. The testicles produce testosterone, yes. The ovaries produce estrogen, progesterone, yes. And the adrenal gland cortex produce two, testosterone, estrogens, and progesterone. What is the difference? The difference is in female, 97% of the estrogen progesterone are going to be produced by the ovaries, and only 3% of this estrogen progesterone produced by the adrenal gland. On the other hand, we have males. Males' testicles produce 97% of testosterone are produced within the testicle, or in the testicle, or by the testicles, and 3% are going to be produced by the what? Adrenal gland. Okay, so cortisol. Cortisol, for this, you need to remember the table of 10. We did the table of 10 already? Yes, right? Table of 10, remember the table of 10? Jasmine, we remember the table of 10? Someone, Mark? Table of 10, we remember the table of 10 or no? Tell me, we did it or no? We did it, right?
I think we did it, but
Okay. Table of 10. This is question for the exam. Table of 10. Table of 10 related to the cortisol. Okay, so table of 10. Number 1, make you awake. Oh no, I'm going to start with the beginning. It's going to be called the stress hormone. You want to be stressed? Yes or no?
no.
The answer is yes. We love stress. Stress is going to be important to survive, for survival. Stress is what is going to make you do things. Why is that? Because the stress hormone, the cortisol, are going to increase the glucose in blood. Before that, sorry, I'm going to make something else. Stress hormone are going to make you awake. Tell me the proof of that. Let's make it the proof of that. If you're overstressed, can you sleep?
No.
No, right?
No.
Why? Because you now homework. When you're stressed, you're going to change stress with a cortisol. You're going to say, my cortisol is very high, instead to talk about stress. So you know stress is basically cortisol. Okay? You okay with that?
Yes.
Number three,
Yes.
it's going to increase the glucose in blood. Increase the glucose in blood. Increasing the glucose in blood is through what we call the gluconeogenesis. Neogenesis. Gluconeogenesis. The gluconeogenesis. So this is really important. What is the gluconeogenesis? It's proteins that turns into glucose. We talk about in the first lectures of bioscience, right? And this glucose is needed, especially in the morning, because the cortisol are going to be high, is going to be high in the morning, and is going to be low normally at night. Okay? So you open your eyes in the morning, you are stressed already. You are stressed already. You didn't eat at least 6, 5, 8 hours. You were sleeping. So you are basically hypoglycemic. So what is doing? The cortisol is going to put glucose into your blood. And that is giving you energy to start to do your stuff during the morning. Okay? You okay with that? So, please.
Yes.
Okay. Number four. Number four is going to depress the immune system. Depress the immune system. You want proof of that? Let's make a proof. Do you know somebody who is stressed out all the time? Do you know somebody?
Yes.
Yes.
Tell me, do you notice that person gets sick more often than others?
Yes.
Yes.
There you are. Why? Because too much stress, too much cortisol. What is cortisol doing? It's going to decrease the immune system. All the white cells are going to be what? Yes, can you repeat, please? Or tell me, or what? 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 The white cells are going to be totally dumb. So they're going to be like a drunk, white cells. So they're not going to respond. So that's why people with stress have the tendency to get sick more often than others. Okay? Okay with that?
Yes.
Yes.
Number 5 are going to cause osteoporosis. Osteoporosis. So this cortisol, too much cortisol produce the demineralization, the decalcification of the bones. They can lead into osteoporosis, so weak bones. Number 6, water retention. Water retention. Now, if you see here in the adrenal gland, I told you that we have here the cortex, and the cortex is going to be produce cortisol, aldosterone, and is going to produce sex hormones, right? So aldosterone itself is the king, the queen of absorption sodium, or to absorb sodium. If you absorb sodium, sodium is going to be followed by water. That is the king, the queen of all the substances, all the hormones. The one who make absorption of more sodium is the aldosterone, period. Now, these cortisol, sex hormones, and aldosterone are produced in similar area. It's like they are cousins. They are cousins. Tell me, your cousin looks like you a little bit or not? Right? So this actually is because of this, they are going to have similar properties. And cortisol is going to have one of that is the absorption of sodium too. Not as much of the aldosterone, but at the end, absorption of sodium too. You okay with that?
Yes. Yes.
Estrogens, for example. Estrogens is another cousin. And estrogens, when you have too much estrogens in the mid-cycle, the estrogens actually, you feel that your pants are not fitting on you. Your blouse is not fitting on you. Your bra is not fitting on you. So you get upset. I'm gaining weight. I don't want to see anybody. Right? Or no, right? So what happened is the estrogens, as a cousin, they have some water retention. That's why. Okay? Okay or no? Why
Yes.
Okay. Number 7, can produce gastritis. Number 8, produce irritability. Do you have somebody who is taking cortisol all the time? It's very irritable, very irritable, very much irritable. When I was young, I was very kind of asthma almost every day. I was taking corticoids. That's why I didn't grow that much. But anyhow, so corticoids are actually make you very irritable. In my house, they know already me. I was very irritable. Whatever, I was really upset. That is a consequence of the corticoids. Number 9 are going to produce lipolysis, lipolysis. So that means that are going to increase the levels of cholesterol in blood. And number 10, what I want you to remember is that this cortisol is a potent anti-inflammatory. Saying that cortisol, listen to this very careful, cortisol is not used for pain. Cortisol is not used for pain, not for pain. No. Cortisol, no pain. It's not used for pain. Cortisol is used for as anti-inflammatory. You want proof of that? I will give you proof of that. Let's go to Safeway or let's go to Walgreens and buy this hydrocortisone. Do you see this hydrocortisone or no?
Yes.
So it's used for what? For some minor irritations of the skin. Yes or no?
Yes.
Yes.
So irritation, I will tell you one thing that is important, okay? You can get anybody, if you ask this question to anybody, and tell, what is the difference between irritation and inflammation? Okay, I will tell you now. Irritation is a semi-colloquial way to say inflammation. It's not really a medical term. It's not really a medical term. The real term is going to be inflammation. But when you, in medicine, basically doctors too, they use irritation. For example, you have irritation of the skin. We don't say inflammation of the skin unless it's very kind of cellulitis or very, very well marked inflammation. You would say inflammation. But you have a small redness here, it's irritated your skin. So that is basically another way to say inflammation. But depends the moment that we talk about. So we need to live with that. But irritation is basically translating inflammation. We okay with that?
Yes.
Okay, thank you. All right, so that is the cortisol. So the table of 10 are going to be asked in the exam. Table of 10, the cortisol, the aldosterone. What is doing the aldosterone? Aldosterone is an hormone that is, this is the name. Well, I'm not going to confuse. Aldosterone is going to basically go to the kidney. And what is doing the aldosterone in the kidney? Is going to reabsorb sodium. Yes, aldosterone reabsorbs sodium. And sodium is going to be followed by water. Okay? You will learn that it's very important to maintain the blood pressure. That is not your time yet. So aldosterone reabsorbs sodium. Kidney, this is kidney. Reabsorb sodium. You follow me? We okay with that?
Yes.
Yes.
Okay. Now, promise me that you're going to remember this. When sodium is being reabsorbed, why reabsorption? Why, by the way, why I don't say absorption? Why I need to say reabsorption? Why? Because the sodium is being absorbed by the intestine in your diet for the first time by the intestine. First absorption. Then they go to the bloodstream. Then it's going to be filtrated by the kidney. And the kidney filtration the kidney is going to absorb for the second time the sodium. That's why it's called reabsorption. Okay? Now, what I want you to remember about this, and don't forget this, please, is this. When sodium gets into the kidney, reabsorbed by the kidney aldosterone, okay, there is an exchange. Enter sodium and exit potassium. That is the exchange. When you reabsorb sodium, the kidney is going to exchange by the elimination of some potassium. Don't forget that, please. Okay? This is going to be so useful. All right? All right. So now, so that is the cortex of the adrenal gland. Now, the medulla, please, this is important too. And then we are going to do, I guess, pancreas, and we finish. The medulla, we finish the course, by the way. The medulla is going to have two substances, two neurotransmitters. Number one, this is the medulla. I'm going to put the medulla here. The medulla is going to produce the adrenaline. That is where it's coming, the adrenaline, the fight or flight, fight or flight, adrenaline, and the noradrenaline. You need to remember those names. The adrenaline is the same exactly to say the epinephrine. And noradrenaline is the same to say norepinephrine. Okay? All right, so this adrenaline or epinephrine or noradrenaline, norepinephrine are going to be called the big umbrella called catecholamines. Don't tell me I didn't tell you. You're going to see that in the exam. Catecholamines. Anusha? The catecholamines. Okay? Catecholamine. So, what is adrenaline? A catecholamine. What is noradrenaline? A catecholamine. What is epinephrine? A catecholamine. What is norepinephrine? Catecholamine. What is adrenaline or epinephrine? Catecholamine. What is noradrenaline, norepinephrine? Catecholamine. What is adrenaline, epinephrine, noradrenaline, norepinephrine? Catecholamine. Give me one example of catecholamine, adrenaline. Give me another example of catecholamine, noradrenaline. What are the catecholamines? Adrenaline and noradrenaline. See? You okay with that?
Yes.
Okay.
Yes.
Now, what I'm drawing here. This is the spinal cord. Right? The medulla. From this, there are fibers coming from the sympathetic nervous system. Sympathetic. This sympathetic nervous system, so sorry, from the middle, it's not from the center, from the terminal here. There's fibers coming from the spinal cord. They go directly to some of them are going to go directly to the medulla. And that is how they are going to produce the adrenaline and the noradrenaline, the sympathetic nervous system. So the chromaffins, well, okay, I'm not going to mention the name, but these cells that are in the medulla are actually nerve cells that are produced neurotransmitters that are called the catecholamines, the sympathetic nervous system, the fight or flight. You're fight or flight, you're stressed, you're angry, you want to fight, you want to kick. So who is working? The adrenal gland. What portion? The medulla. Nice or not? It's not nice? You don't like adrenal gland, right? You like? Why you keep silence? Hello? I'm on? Oh, what?
No, we don't like it.
Nobody like it?
No.
You like it or don't like it?
No.
Not like it? Well, I'm sorry that you're going to see in your exam. Yeah, it's going to be in your exam. All right, so anything to clarify? Anything is clear or no? All right, so let's continue. So we have the adrenal gland, and all right, so we are going to go here. Let's finish with the, okay, so this is the glucocorticoid, that is the cortisol. When you have excess of cortisol, are going to produce what we call the Cushing syndrome. Give me 10 minutes. Cushing syndrome. That is an excess of cortisol. Who's having excess of cortisol? You're going cortisol in autoimmune disorders. Autoimmune disorders. The autoimmune disorders, what it's doing is the immune system are going to destroy your own body. Example, lupus, kidney. Example, diabetes, the kidney too, other organs too. Another, myasthenia gravis, the receptor for acetylcholine, the multiple sclerosis, the myelin of the axons, psoriasis, the skin, arthritis, rheumatoid arthritis, the joints. So all these, actually, you remember the thymus are going to produce the T cells. The thymus are actually what is doing, what is happening. Tell me, I explained this before or no? Okay, so I will explain you now, no matter what. So we have, remember you are the thymus. The thymus, your room is the thymus. You are the lymphocyte T. The house is your body. Your house, your body, your room, the thymus, and you are the lymphocyte T. What is your job? Your job is going out of your room, the thymus, and recognize all your body. Recognize all your body. Oh, this is my window, this is my door, this is my light, this is my Christmas tree, this is my glass, this is my shoes, everything. I know what is mine, what is not mine. So at the moment that something different coming, you can recognize this is not part of my body. So then you're going to destroy. So that is normal. That is what happened on you and me. But autoimmune disorder, these lymphocytes are going to keep memory of all that for the rest of your life. But we don't know how, when, what is the reason or factors that all of a sudden the lymphocytes become amnesic. They lost the memory. They cannot recognize you anymore. And these cells, probably they are not recognized, your joints are going to destroy the joints. They don't recognize the kidney, they destroy the kidneys in case of the lupus, etc., different autoimmune disorders. So that is going to basically call autoimmune disorder. It's the auto-destruction. They're going to destroy your cells. Why? Because the T cells, they forget. They cannot basically recognize that this is part of your body, and that is going to be attacked. It's going to go through a process of inflammation. Remember the 5 cardinal sites of inflammation, and inflammation are going to be already destruction of cells. So rheumatoid arthritis, psoriasis, MG, multiple sclerosis, myasthenia gravis, all those are going to go through inflammation. So the main treatment for that is anti-inflammatory. The main treatment will be the cortisol. Too much cortisol are going to give you the table of 10, and they are going to have retention of fluid. So that's why this is a before and this is an after treatment of the cortisol. That is what we call Cushing syndrome. Cushing syndrome, one key word that we need to remember is the moon phase, and the buffalo hump. We have acanthosis nigricans, as another time, buffalo hump. So basically, is deposit of fat is like a hump. That is Cushing syndrome. There's other ones that are going to happen. Basically, you're going to increase weight, gain weight, and just remember the phases are going to be totally changed. Totally changed. You're going to be really, really gaining a lot of weight. Corticoids. Aldosterone, what we talk about, aldosterone is to reabsorb sodium, and when they enter sodium, exit potassium. The last one, we are going to talk about the pancreas. We talked at the beginning about pancreas. It's a mixed gland, exocrine and endocrine. What is the exocrine portion? The exocrine portion is this. That is actually the Wilson's canal or the pancreatic duct. It's like a river, right? All the way down. So that is going to release the pancreatic juice. You remember the pancreatic juice is composed by bicarbonate, the lipase, the protease, and the amylase. We talk about that. Water and electrolytes. pH 12. Just to refresh you for the exam. Okay, so that is the exocrine fluid coming into the duodenum, right? Now, we have the islet on Langerhans. Imagine the pancreas like a gelatin, and these blue dots are the blueberries floating in the gelatin. So these blueberries are the islets on Langerhans. These are the ones who produce some hormones that we will see now. Let me see if I have the pic. There you are. So these blue scenes here, this graphic is not so nice because mostly are located in the tail of the pancreas. Anyhow, so we have this islet of Langerhans. You need to know the name. That is the endocrine portion. The endocrine portion. The pancreatic juice is the exocrine portion of the pancreas. So that's why pancreas is a mix, endo and exocrine. So these islets on Langerhans is this. This is the islets on this. These are the islets on Langerhans. What do we have inside the islets on Langerhans? We have these cells. These cells, we have 4 types of cells, but we are going to just talk about 2 of them. Alpha cell here, the dark blue, and the beta cell, that is the light blue. We have gamma cells and delta cells. I'm not care about that right now. So alpha cells, what it's doing is to produce an hormone called glucagon. And the beta cells are the majority of beta cells in these islets of Langerhans are going to produce the insulin. Okay, so with this topic, we are going to finish. All right, so what is doing the insulin? So please review this chart, okay, this graphic, okay? What is doing the insulin? All right, so I am the insulin. Insulin is a protein, it's an hormone produced by the pancreas. So what is doing the insulin? The insulin is going to go to your house and knock the door. Boom, 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 knock the door. All right, you open the door because somebody is knocking. And what they're going to give you? Glucose. There you are, your glucose. The delivery person is not going to get into your house. Is going to continue his job. He's not going to get into the cell. Who is this guy? Is the insulin. The insulin is the one who open the door to enter glucose into the cell. You okay with that? So what is doing insulin, RB? Insulin is going to make in the glucose. The glucose is going to get in with the insulin. Insulin inside glucose. Okay? Now, I want you to remember one thing here, please. Don't forget that. Please, write it down. Every time the glucose enters into the cell, they need to enter with a little bit of potassium. When the insulin gets into the cell, the glucose gets into the cell, the glucose enters into the cell, they enter with The glucose enters with a little bit of potassium. With potassium. Okay? And the last one, glucagon. Glucagon is, what is doing the glucagon? Very simple. The opposite of the insulin. The opposite of the insulin. So what does it mean? That is going to take glucose from inside the cell, outside the cell. From inside to outside the cell. Simple of that. Question for the exam, you will have that you have what are hormones that act opposite? Hormones that act opposite are going to be the insulin and the glucagon. Other hormones that act opposite, calcitonin and PTH. With that, colorín colorado, este cuento se ha acabado. So that means the story is end. With that, we make official our ending of bioscience. How you feel? Right? So
Confused.
tell me one thing. The first day you came to class, how you feel now? You feel different? Right?
More
Tell me.
stress.
More stress. Okay, that's good. Stress is good. Stress is good. So you feel more strong now, a little bit more secure of yourself, more and more. That is what is doing in education. And that's why, actually, after many years of experience teaching, that's what I want to offer to you. But the merit and the credit to do that is yours, not mine. I always tell my students, whatever achieve you have, 20% is mine. And probably it's a little bit too high, but 80% minimum is yours. What I'm trying to tell you is that your success is up to you. And you are able to do everything in this life. You're young, you can actually face any difficulty, and you keep going. I can give you many examples in my life, but I'm not going to do that. Someday, when it's the time. But in order to pass all the difficulties in life, are going to be very, very, very much depends on your effort. I will tell you one thing very fast. When I came to United States, I didn't tell you. Probably I'm going to complete the story another time. But when I came, I was director of 3 hospitals. I was having everything in life that a doctor wants. I just came because of my family. And when I came here, I tried to find a job. I couldn't find. And you know what was my first job? Meantime, I was passing my boards. I was delivering newspapers. From director to be, I was crying, literally, no, totally, literally, exactly like this, crying, throwing the newspapers. Newspaper. And for about a year. Then I will start to clean. I was in a nursing facility for Alzheimer. I was cleaning every day, pees and poos. And then, just to make short the story, I was hired as a personal care, not even CNA. And I was doing everything, from cleaning, from cooking, to taking care of the patient. And these people, he was a doctor. He was Skolnick, was his last name. He was Harvard psychiatric. And in a few short time, they take care of me like I was their kid, his kid. And I learned everything I learned now. How to behave, actually, the good dinners, the salmon from Alaska, the lobster from the Atlantic, the wines and all that. Operas, music, everything in 4 years. And for me, it was not easy. I was always trying to go back to Peru, but I say, I don't need to be here. I didn't want to be here. But my father was telling me, you need to come because you promised. And this, Papa, this is the last promise I'm going to give you. And then I stay. I pass my boards. They want to send me to Nebraska. I didn't want to go. And I start to be in Gardening Academy. In Gardening Academy, I met my wife. She was a student. I was a student with her because I studied with her. She's sonographer too. I was sonographer too. I have 3 licenses. Besides MD, I have vascular, OB, and abdomen. 3 licenses. And I decided to teach since 2004. And since I've been here. And I like you guys give me gray hair all the time. But I love it very much. Thank you for being there here. And I want to tell you the last thing. I learn from you guys too. Every time I'm teaching, I always open my mind for new ways to perspective to see things. And I need to thank you for all of that. But you know what? You are the future. The future not yourself, but for your people, for your family, for your kids, for your parents, for your everybody. You're the hope. So keep going. Never, never, never try to quit. You are able to do it. And there's many other examples that I can tell you, but it's not the time. It's not the time. This is kind of very common to say for me. Muchas gracias. So that's all for today. And I will see you when?
Sunday.
Monday. Oh, Sunday, yes, Sunday. Oh, by the way, I want to tell you something. We have quiz number 19. Yes, it's quiz from this class, right? So what we are going to do is we are going to take the quiz that day on Monday. Okay, Monday 13, I guess, right? Monday 13. And after that, we are going to do review, preparing you for that Wednesday. I'm going to put the label in order you to upload your COVID-19 test. Yeah, so people who cannot, they have some personal or special issues here, we can talk. And but let's not get too much stress. Stress is good, but not too much. Okay? All right. Muchas gracias. So if any question, please let me know. I will be more than happy to help all the time. Text me before 12 o'clock p.m. Okay? AM, sorry. All right, so muchas gracias.
Thank you, Dr. G.
Thank you, Dr. G.
Thank you, Dr. G.
Thank you, Dr. G.
We conclude the Bioscience course, and yeah, you're one step from your core program, Module 1. Okay, I will see you then, by the way, too. I'm going to teach you AMP and nutrition. Okay, guys. Muchas gracias.
Good night.
Doctor, I have a question.
Dr. G, I don't know if you got my text message.
Yes, I read like 100 miles per hour. So just tell me. You want to talk to me personally?
Yes,
Okay,
please.
okay. All right, so let's wait a little bit and you call me. I want just to check if somebody needs. Oh, Tashi.
Oh
you're
yeah,
here.
I know you said you were gonna upload the midterm grades.
I did it already.
Oh, okay. All right. Thank you. All right. Gracias, Dr. G. Thank you so much.
Thank you, Mrs. Steffi. Thank you. So you sisters, RB and Tashi, right?
Dr. G, I have a question about the math and medical term. Is it included on campus or?
Yeah, it's going to be including campus. Yeah.
Okay, thank you, Dr. G.
So, by the way, RB, you just remind me if we can do math review on that day, Monday.
Okay, doctor. Yeah.
Okay, Miss RB. Thank you. Miss
Thank
Tashi.
you.
Thank you, Miss RB. Miss Tashi, you want to say something? No?
Dr. G, I just want to ask if I could get the results of my COVID test before Monday.
Yeah,
Can
that's
I
fine. That's
get
beautiful. Yeah.
my? Can I take the exam by Monday or no?
What is the problem with Monday?
Cause I have work by Wednesday. Cause I told them my last day at school is Monday.
Yeah. Miss Tashi, let's do this. If you can, try to adjust that. If not, I will find a solution.
Okay,
Okay, but
Dr. G.
but help me with that.
Okay.
Honest try. Okay.
Okay, Dr. G.
Okay,
Thank
Miss
you,
Tashi.
Dr. G.
Muchas gracias too. Always a
Thank
pleasure.
you. Good night. Bye bye.
Good night. Good night.
Dr. G, so
Without wishing, I record what I was saying.
oh,
I'm going to stop this.